I've been reflecting throughout this summit how some patients stay with us as clinicians throughout our lives. And when I was an intern, I worked in a TB hospital, and I spent one very grueling night, emotionally grueling, with an old man who died. He was dying of bleeding from the lungs. We had to prop up his bed from the foot so that the blood came out of his mouth and nose, so he didn't drown in his own blood. But we could not save him. But not having been in the TB field for many years, the horror I find is that the toolkit has not changed since I was an intern. We have the same diagnostic methods, we have the same drugs, we have the same problems of helping patients to take the drugs and of delivering the services so that they are eased through that path. And we have not improved. So where have we been hiding?
I think it's very clear we need to continue to scale up diagnostics and treatment and link them together, because we have to diagnose, but we have to have the scaling up of treatment also for MDR-TB. Link them together, also linking co-infection, strengthening health systems and moving through the health systems, and especially seeing people in countries that are our objective to continue.
The global financial crisis, based on our estimates, is pushing this year another 53 million people into poverty. We have been discussing the linkage between poverty and TB and the impact that this has at the country level, at the health systems level, at the household level. So we are greatly concerned about that, about the fact that this is an additional strain on systems in general, and of course on TB programs and households and patients in particular.
In the last 6 years, the world came together to actually bring a response, mobilize itself, and we've seen an unprecedented mobilization of resources, of partnerships, and we've seen what the world can actually achieve when it comes together with one objective. Remember, 6 years ago, basically no one on antiretroviral treatment in the developing world. Today it's 4 million people. And it's 4.6 million people that has now been diagnosed with TB and treated for TB through Global Fund support. So that is what is changing. And now there's hope. There is hope. And as someone was saying, you know, I believe hope spreads faster than MDR-TB. So what is needed here? First, we need more ambitious, high-quality proposals from countries. Second, we need to learn to work better together, to join in the appropriate partnerships, to avoid duplications, and that is one of the reasons why with Gavi and World Bank we're currently working on aligning on joint windows for funding for health systems. And this is why we need to move into innovating funding for development.
We have to look at, as we go to a community-based integrated approach, how do you best address the series of things that impact the family, the community, the children? TB is among those that has to be on the list of priorities, and the interaction of that with a family-based approach. This is something that if you diagnose in one member of the family, you have to be able to look at the rest of the family. When you look at the kinds of things like tuberculosis, which may not be one of the biggest killers of children, but is among those things that has to be really addressed in a community-based integrated approach, which I think we're trying to move to really save as many lives as possible.
But I suppose it divides into two parts. One is obviously the program side and the program delivery. It's not just the volume of finance, it's the characteristics of that finance. Is it long-term and predictable? Can you build ambitious programs? What kind of financial instruments lend themselves best to that? The other part, I suppose, is what kind of financial instruments or incentives are needed to shape markets, to drive markets, to allow the research to take place, and what are the right kinds of instruments. And I think at this moment in time, we've now got a lot of experience in different kinds of incentives, different kinds of instruments, different ways of working to generate new products, bring those products to market, and then scaling up the development side and the production side. And I think if we could link as a TB community with others, I think there's a lot of lesson learning perhaps, and maybe it might be the right time now to do some stock taking. What have we learned from these different kinds of instruments, from these different communities that don't always talk closely enough together?
I think that the challenges are as follows. I think the challenges to the world of science are to understand the biology better, to work out what really is going on in latency, to understand the variation of the organism. And I think the challenge is to turn the new genomics, which offers the most enormously powerful scientific tool, into new tools, new therapies. The second challenge to science is to work effectively with industry. And of course, that challenge works equally for industry to work with science. And I do believe that we are starting to see cultures of open innovation. And I think that it's know-how that really matters most of the time. So turning to industry, the challenges are obvious. Make us new vaccines, make us new drugs, make us new diagnostics. But of course, none of that is easy. And again, it's important that we collaborate. I think it's well recognized that because combination therapies are going to be needed, industry needs to work with regulators, and actually regulators have an accountability to work with industry. This is a situation where if you try to introduce things singly, the permutations become very complicated, and we've actually got to find ways to regulate through combination therapies. Turning to the world of policy and politics, you've got to work on this as well. You've got to provide the pull and the incentives to encourage industry and academia to do their stuff. Really, industry can't do things if there is no market of any form at all, and therefore policymakers and politicians and governments have to provide those markets.